good morning and welcome to the first Heartist meeting in Rome. This is the third episode of In Conversation with Knights, and today we are hosting Professor Saridogan from the UK, whom we thank for having accepted our invitation for a short interview.
Pleasure.
Thank you, Professor. First question is, what is the kingdom you identify yourself with?
Oh, well, obviously, look at my badge, it's hysteroscopy.
What then is the strongest weapon as a procedure or a technique in the kingdom you belong to for the management of the infertile or subfertile patient?
So there are two aspects. One is the diagnostic aspect, that we confirm diagnosis, and second aspect is treatment. I think the strongest part is the treatment aspect, because we can actually resolve problems that may be causing infertility. But diagnostic aspect is also important because there are certain situations when we cannot diagnose certain conditions by listening to the history or doing an ultrasound examination only.
Perfect, thank you. Next question is, considering the latest recommendations, what is the update or modification you would fight for the uterine factor evaluation, if any?
Yes, so in terms of recommendations, and especially with recent publications from the Netherlands on the impact of septum surgery, I would promote collecting data prospectively to see if we can identify factors which determine the reproductive outcome. So we can identify who is going to perform badly or who is going to do well and does not need surgery.
Thank you very much. Next question is, what is your unpopular opinion among the other knights in your kingdom regarding the infertile patient management?
Okay, so perhaps the most unpopular aspect is that I agree that there is a proportion of women who have certain abnormalities, such as T-shaped uterus or subseptate uterus, but will do well. So I do not feel that we need to offer them as a blanket approach to undergo surgery.
At the opposite then, what is the most medieval practice still ongoing on the battlefield?
Well, I think in this day and age, it is unacceptable that if a woman keeps having failed implantation, despite having a septate uterus or T-shaped uterus, they should not really continue with further fertility treatment. They should have surgery first.
Thank you very much. And the next question is, for the purpose of the win, that is reaching the fertility outcome for the patient, which one do you think is the strongest as a partner between the other two kingdoms?
It's difficult. I think it's difficult to choose between the two. And you know, for diagnosis, obviously I'm with ultrasound, but for treatment, we also need to work with the ART group. So it's difficult to kind of choose one over the other one.
Thank you very much. And the last question is a provocative question. If you could choose only one knight to duel, to challenge, who would he or she be?
Okay, so that I would probably choose Mark Hans Emanuel from the ultrasound kingdom to challenge his contribution to the septum surgery concept.
Thank you very much, Professor.
Thank you,
Thank
Sarah.
you.